Thank you for joining us today. On behalf of our federal partners, I would like to welcome you to the Focus on Aging Federal Partners webinar series. My name is Erin Long, and I will be your moderator today. This webinar series is a joint project of federal agencies that support health and wellness in older adults across the United States. The partner agencies are the Administration for Community Living, the Agency for Healthcare Research and Quality, the Office of the Assistant Secretary for Planning and Evaluation, the Centers for Disease Control and Prevention, the Centers for Medicare and Medicaid Services, Health Resources and Services Administration, the Indian Health Service, the National Institute on Aging within the National Institutes of Health, and the Department of Veterans Affairs. You'll see all of the logos across the bottom of the screen. Next slide, please. Our discussion today will be on resilience in caregiving. I'm not going to read out all of the names of the presentations that we're going to hear today, but I do want to introduce you to our panelists. So next slide, please. We have Loretta Vini, author and inspirational speaker, and she'll speak her presentations is entitled From Despair to Resilience. Dr. Wanjin Cho, assistant professor at the Steve Hicks School of Social Work at the University of Texas at Austin. Dr. Fawn Kothran, Hunt Research Director at the National Alliance for Caregiving. And Diana Shula-Coast, Founding Executive Director of Lorenzo's House. Next slide, please. Just a couple of housekeeping items, actually just one. We are going to have a question and answer session after all the panelists have completed their presentations. If you'd like to send in a question, please click on the Send Live Feedback button that you can see on your screen. That will get the question to us, and then we'll be able to answer as many as we can at the end of the presentations. With that, let's get to our first speaker. I'd like to introduce Loretta Vini. Loretta?
Thank you so much, Erin, for having me today and for introducing me. I am absolutely thrilled to be here with you all today to talk about From Despair to Resilience. And I hope you're going to enjoy 4 of the greatest lessons I learned from being my mom's mom. Now, I want to introduce you to Miss Doris. There she is with me. And as you can tell, we are doing a selfie. Well, of course, when you have dementia, you don't know what a selfie is. And one of the favorite things I love to remember about my mom was she, as you can see, she's looking at the screen and she says, "How did we get into that box?" Just like that. And to this day, I laugh and laugh about that. It's one of the best memories I have of her. And she died in January of last year, 2022. Here we go. All right. First lesson. Learn every single thing you can about this disease. And then in that same vein, advocate for your loved one. I learned that on the very first day. So as you can see, those are the 2023 Alzheimer's disease facts and figures. And when I tell you I learned every single thing about it, I felt like I was back in graduate school. I read every book. I attended every seminar. I'm sure people were saying, "Here comes that woman again." But it was just my number one goal to learn everything about it. I was also learning about multiple sclerosis. Unfortunately, my sister was diagnosed 2 weeks after my mom was diagnosed with dementia. And my mom was 77 years old in 2006 when she was diagnosed. So 16 years for us with that crazy disease. All right. Part of learning everything, as I just said, is about reading whatever you can get your hands on. This is the AARP Prepare to Care. Woo, that was the thing. It had checklists, addresses, phone numbers, websites. I tore pages out. I wrote in it. I did everything I could possibly do. And the other thing that was interesting, for me, is in 2013, we were well into the disease by then. I decided to write this book, being my mom's mom, about our journey. I wanted to not only share my mom with the world, but It also helped to pay for her care because I was terrified that at 77, when she was diagnosed, that she would outlive my money. And so I wanted to make sure we had that. But I was hoping to, as she being the first one in our family to be diagnosed with this crazy disease, I wanted to make sure other families were not as unprepared as we were. Good grief. It was quite the thing. We ended up in the New York Times as well. I was just so proud to have our book recommended as, something for elder care that was really, really helpful. Now, here's the advocacy part. During COVID, my mother broke her clavicle in the fall, and the fee that they wanted to charge us, they wanted her to come in a wheelchair to the hospital to check out the bone healing. And so that required medical transport, right? Well, during COVID, I called just to see how much it would cost to, get us there and make a reservation. $400. We were not going to do $400. And so I advocated for her. I was really upset about it. And I finagled a ride with the group home where she lived. They had an activity bus, and they took us on the activity bus. But I wrote all kinds of letters after that. How can you, in a crisis such as COVID, how can you overcharge? They said, well, it's the cleaning fee. I could have cleaned the entire city I lived in for $400. But okay, another story entirely. And the other thing I really want to share with you is please never be afraid to fire a doctor if necessary. My mother's first neurologist burst into the office and said, "You're in the beginning stages of dementia." He never made eye contact with us or anything. But when my mother said a few times she didn't want to take another medicine, and he was trying to prescribe Aricept and push the prescription across the table at us. And, by the third time she says, "I don't want to take that." He says, "That's what's wrong with you people. You don't want help. You just want to complain." Do I need to say that we got our belongings and we left, never to see him again? So please don't be afraid to switch doctors if you feel that you are not being heard. Your loved one is, the most important person, and they have to respect that as well. So go with somebody with whom you can feel comfortable. That's lesson number 1. Lesson number 2, prepare for everything, yet be ready for anything. That photo on the left, my mother's on the back row with my grandparents. She was 13 in that photo. And I put at least, I had like 700 photos on my phone from 1929 when she was born until 1949, which in her middle to late stages, I was about as far as she could go. Now, I use those photos to keep her calm in the car, DC, traffic, think that. And she could, I taught her how to swipe, and the pictures would just scroll by. It was amazing. She would name people that I had never heard of. And it was a wonderful way to keep her calm and relaxed. So have things on hand that will be helpful in that kind of thing. This is funny. This was Easter years ago. My granddaughter in the back of that picture, she was doing that picture. She's now 11. And this was the first picture we took of when my mom was starting to get really feisty about food. She would eat. She had a piece of that cake. And then she said, "I would like a piece of cake." And we said, "You had cake just a minute ago." I would know if I had cake. So rather than argue with her, that was the day that taught me take pictures of everything we do. Because she would be in Walmart and she would say, "They don't feed me. So please, whatever it takes." And every time we took a picture of something after she had, while she was eating, and then after she was eating with the empty plate, and then she would ask for more or not remember that she had it. And we would show her the picture. She would look, she has on the same outfit as in the picture. And then she would look sad. "I guess I did have cake." "Yes, you did." And then she said, "Well, did I like the cake?" "Yes, you loved the cake." So you have to learn those kinds of tricks to keep the arguing down and to really come up with strategies that work for you. Now, I'm a realist, so I'm going to keep it real for you. One of the hardest things is not only when they forget who you are, but sometimes, barely can remember who they are. That is one of the saddest Mother's Day pictures ever. You can see she's holding this balloon. She has no idea where she is or anything. That's just heartbreaking, but it is part of the process. A little bit after I took that picture, she did come around a little bit, and she kept reading her Mother's Day card out loud. So, kind of wait for those bad times to sort of pass, but be ready, because it doesn't feel good. Just be ready. Who knew my mother would run off. We were born and raised in Washington, D.C. We are fifth generation Washingtonians, but because I couldn't afford anything for her in D.C., I moved her to Prince George's County, Maryland, where I live, and she never forgave me for it. So every time she ran away, she was trying to run back to Washington, D.C., where she was born. So people always say to me, oh, I don't think I need an ID bracelet. My mother won't run off. Okay. They never wander until they do. So be ready. Now, same lesson, but look at the last line. Have a plan and a backup plan. That man in that picture with us, that picture was Mother's Day of 2016. It was the last picture of the three of us together. And while we were on vacation in New York, my husband died very suddenly. The most shocking thing ever. Who would think that your spouse would outlive your parent, for whom my husband did almost everything? He was a retired DC cop. He would drive my mother to the doctor, and I would meet them there and do the appointment. Then they'd run off to lunch and shopping and all this kind of stuff. They were inseparable. And I didn't have a backup plan for him. Thankfully, my church started my own little support group just for me. And they asked me to write out all the things that Tim had done for my mom. And each one of them took a thing. So please have a village, not just trying to do everything by yourself, and know who you can call in your village. Never saw that coming. Ironically, my sister died from MS on July 17th of 2011. And then 5 years later, my husband died on the same day in 2016. That just left me and Mom. Well, this is a GPS for the shoe. My mother kept running. So the second time she escaped, I had to put a GPS in her shoe. So really investigate what you are going to need next, right? You might have everything you need right now, but something else is coming. So we put that thing in her shoe. I'll say more about that in just a little bit, but it was amazing. And it tracks you to the, an inch of where they're standing. So you set it up, and if they cross over the threshold, wherever you set it, in this case, it was the front door of the group home, and she went outside and they hadn't called to say they're going out for ice cream or something, your phone would vibrate just like an Amber Alert. It was spectacular. Kind of pricey, but I slept well. It was $200 or so for the insert itself. It's like any other insert. You get a CVS insole kind of thing. And but it must have a fabulous cell phone service. It does not work without that. Wow, this was kind of a heartbreaking thing. My mother's 92nd birthday and her last birthday. She died 2 weeks before her 93rd birthday. And it was really sad. You can tell that's during COVID, but her t-shirt's funny. The caregivers bought her a sweatshirt that said, I turned 92 in a quarantine and none of you are invited to my party. So she's reading the card for me. I got those balloons and I watched them eat cake from outside. But hey, if I had known that was my mom's, last birthday, probably not much I could change about that. But, I did everything I could other than that. So please remember that. Have a plan and a backup plan. Lesson number 2. All right. Lesson number 3, focus on what they can still do. In all the support groups that I help moderate, oh, my mom can't do this anymore. Oh, my dad can't do this. Oh, he used to be able to do that. You will drive yourself absolutely crazy counting all the things they can no longer do. I chose to flip that around and choose what she could still do. And I'll show you in a second. She could do a lot of stuff. One of the funniest things that happened, this picture is from my mom's high school yearbook in 1947 when she graduated. She's all the way on the front row, all the way on the right with the dark sweater and the plaids because she's holding some maracas. You can't really see it. Well, the New York Times had come to interview us and they wanted to see my mother still way after she forgot who I was. She still knew all the girls in this picture, right? That was her favorite club, the Spanish Club. So she's naming Becky and Susie and Joanne and all these people. So the New York Times, if you look very carefully, there's a boy in the middle of that picture in the back. So she skips him. So the New York Times guy says, well, who's that boy in the back? She says, I don't know. I don't know him. We weren't friends or anything. He was like, wow, that's so strange. You knew the rest of them, but you don't know him. And she says, no, don't know him. And I don't know why he wanted to be in a club with all girls. Well, it turns out this is what I call selective dementia, which they also have at times. And so she clearly knew that boy in the back for at least a minute because that boy is my father. So she forgot all about being married and having kids and all that stuff. But it was really cool. So she could still do a lot of stuff. Now, if you've ever been on the AARP site in their caregiver stories, they give names to all of their caregiver profiles. They named me the entertainment director because I wasn't going to take that blank stare of dementia. I absolutely hated it. So then you can see there we are playing ball during COVID, and I got her one of these picture games. You can see how fascinated she is. And for her 90th birthday, she and I published a coloring book called Colors Flowing from My Mind, which is a direct quote from her. So who publishes a coloring book at 90? But there we are, and I just kept her really, really busy. Man, she was feisty. That you can see the chairlift there on the left, but she was like, I want to go up by myself. And so she would pull herself up. And when they sent me that picture, well, I guess I took the picture, but I was there. We were getting ready to do a doctor's appointment. But what's interesting about that picture is just I was having a really bad day, and I watched her pull herself up that thing, and we named her Wonder Woman. She was just such a thing. And you can see her writing her name. That was 2 months before she died, and it took her 45 minutes to write that, but she could still do it. D-O-R. But look at her face when she finishes. She's holding up, looking at her name. And then on the right, that picture, I'm a Lego facilitator. That's a long story. But I made her a lot of Lego puzzles also for the car. And you can see her matching them up, the colors and the shapes. We just had a lot of fun. So really focus on what they can still do. This last piece, I think, is so interesting. And people always ask me to explain it. And you know what I mean by having no expectations. Well, first of all, who knew our journey was going to be 16 years, right? So when I say have no expectations, people are like, well, what does that mean? So it means, you know, you'll see in another slide in a minute, we have to pace ourselves. Because if you get too high when things go well, you can celebrate some, but don't get way too high or really too low when things go bad. Try to keep yourself on this kind of even keel. Because, you know, we don't want to raise our blood pressure and all these other kind of things. Just kind of stay within some confines, you know. And so you can imagine where this slide is going. You see the police cars in front of the group home. Yep, she ran off. This is time number 3. And this one's a little serious. She got about a mile. And if you know anything about Washington, D.C. and Prince George's County, one of the deadliest highways is Route 210. My mother got across all 4 lanes of 210. Don't ask me how, without getting hit by a car. And a family found her, and she gets in their car, and they, you know, ask her her name. That's all she knew was her name. They said, well, can we call somebody for you? Who do we know? I don't know. And they were like, oh, no. And then, so they gave her some water and a cookie, and all of a sudden, for the first time in 5 years, my mother says my name, Loretta. And the girl says, oh, who's Loretta? She says, I don't know. So the young girl, who's about 20, she was with her mom, she gets on her cell phone and she Googles Loretta in Maryland. And look at what she gets. This is the Washington Post article. She says, oh, that's them. That's them right there. So my whole name's on there, Loretta Woodward Beatty. So she sends me a Facebook message that says, hey, my name is Tiffany. I think I got your mama. Who knew you could get your mama back on Facebook? Now, really, that would raise you. So we jumped around and was all excited and everything. And that was the last time she ran away. But you see what I'm saying? If I told you this was a Lifetime movie, you would say I made that up. But, you know, getting your mother back on Facebook, that's just crazy. But that's why I had no expectations. People said, oh, I bet you cursed everybody out at the group home. No, I didn't, because I had lost my mother once or twice in Walmart. So if you turned your head, my mother was so fast, she would just dash off. So, you know, having no expectations really is about pacing yourselves, you know? And so there she is, one of my happiest memories. Ice cream was her favorite food. She would have eaten that every day. And the middle thing is funny. I told you we named her Wonder Woman because in March of 2021, they told me she had days to live, and I put her in hospice, which was her wish. So she still was here for Mother's Day. So we named her, you know, Wonder Woman because she was still here. She lived 10 months. And so I was so proud of that. And so this is the day she died. And about 10 minutes before she died, we put those Wonder Woman socks on her. And she earned those socks, those amazing years. And she was the best mom ever. And so it really was about pacing ourselves till the end. But it was just amazing. So what I really want to leave you with, and I hope you enjoyed our family story, but, you know, we went from despair at diagnosis to resilience of making the most of every single day we have. So no matter what you're facing on a daily basis, never forget you've got this. Thank you so much.
Thank you so much, Loretta. Next, we're going to hear from Dr. Sho.
Hey, everyone. It's my great honor to join the panel today and meet you all. And thank you so much, Loretta, for sharing your experiences and really give us a great demonstration what a resilient care partner look like. And today, I would like to introduce our research team's journey in the last 7 years, through which we're trying to understand what resilience means for dementia care partners and how we should define and measure it. I have learned so much from the care partners that I work with during this research work and continue learning from them. I'd like to share my lesson with you as well. I have no commercial relationships to disclose. And this is a member of our resilience team. So first, I want to talk about why our team started to focus on resilience for dementia care partners. We have already heard a lot about how many challenges dementia care partners have to handle every day. They have provided so much. They have provided direct care, care coordination, and health management for people living with dementia. These efforts can make a positive impact on people living with dementia as well as on care partners themselves. However, there are many studies showing that caregiving can be very taxing and that might be negatively affect the health and well-being of the care partner. And when care partners are not well, we know that people living with dementia suffer at the same time. Current interventions for dementia care partner mainly focus on the stress and burden caused by the caregiving. These supports are really important for care partner during difficult time. However, there are limitations of these efforts. When care partner access those services, they are often reaching a crisis point. Those services tend to be some short-term relief, such as respite care or brief counseling, and this approach has limited effects in preventing or relieving this long-term care burden associated with dementia caregiving. And there is a growing interest in developing interventions to enhancing care partners' resilience in managing challenges over the long trajectory of caregiving. And why resilience? Resilience is a concept focused on care partner strengths and what they can do, and ability for them to recover from stressful situation. There are many studies show that resilience is strong protective factors against the multiple negative consequences of dementia caregiving. Resilience, therefore, could be a new intervention target to developing care partner support. In that way, we may be able to prevent them from various negative impacts of caregiving rather than addressing them when it is too late. To make this type of intervention possible, we first need to understand what it means in the context of dementia caregiving and how we should measure it. There are many measures can indicate care partner stress and burden. Our team found that there are lack of resilience measure developed and validated for dementia care partner. Why is that? Because although there are resilience measures developed for other populations, this was a construct that mainly focused on individual strengths and development, such as being perseverant and focus on problem solving. But being a caregiver may require different things to be resilient. For example, some caregiver told me that being perseverant and focus only on problem solving can make them burn out in the end and make it harder for them to ask or receive support. So what resilience means is the context of dementia caregiving. This is the first question our team trying to address. So to better understand how to conceptualize and measure resilience in dementia care partners, our team has conducted a scoping review and proposed a unifying model to resilience. Instead of thinking about this resilience is individual traits, we think about resilience as a process through which care partner utilize their different traits and resources to address the challenges in the context of dementia caregiving and achieve resilience outcome. There are outcomes related to the adversity and also care partners' personal growth and development. Now, how we can develop interventions for that? This resilience process is especially critical as it is modifiable and related to the reduce the negative outcomes and promote positive outcomes. To capture this resilience process, one possible way is to capture what they do, because a caregiver's behavior is objective and more observable, can be used as a good target for intervention. However, we didn't know what behavior can indicate the resilience at the first place. So to identify those behavior indicators, we conducted a systematic literature review trying to find out. There are 4 types of behavior that we have identified from this body of literature. First is we found the resilience means care partner take appropriate action used to respond to different kind of problematic situations. Sometimes you focus on solving the problem, but some other time it is better, care partner says, to distancing themselves from those problems when it's overwhelming. Of course, help is important. Care partners' resilience focus on accessing or accepting support from others. Sometimes it's hard for them to do it. Besides that, we found care partners' resilience require them to adopt a behavior to maintain or improve their own health and well-being, or cultivate a better sense of self through connecting with others, including more self-care activities, developing and maintaining meaningful social relationship, and participating in spiritual activities, and those are very important for their health and well-being. In the end, we found learning-related behaviors are fundamental for care partners' resilience. Care partner have not only, this is the first thing Loretta mentioned, so care partner have to not only learn from others, they also have to reflect on their own experiences and applying them in the caregiving and see how it works. We were very excited about this initial framework because this framework can really inform the development of measures, research, interventions, and policies for dementia care partner that are shifting the paradigms of the existing services. However, there are limitations of the proposed framework. So none of the review studies have systematically examined their behaviors. So we're likely to miss some important behavior that are critical for resilience for dementia care partners. We conducted another study to validate and expand this behavior framework. So we interviewed 27 care partners. We're asking them what they have done to deal with the challenges when people living with dementia had a health crisis, and what behavior they found helpful. So this is a critical time point that care partners have to adopt different behaviors to overcome these caregiving related challenges in front of us, which provide a lot of useful information and insights that I would like to share with you. So based on this interview, we validated and expanded our original framework. We did miss something important, and I would like to point them out to you. First, we found a new domain of behavior. It sounds obvious, but we missed it in the beginning. It's called compassion-related behavior. Those behavior are those care partners use to respond to relieve others' suffering or benefit others' well-being. It sounds intuitive or obvious, but a lot of times those kind of behaviors being viewed as being harmful for caregivers' well-being. But care partner tell me no. Be able to sacrificing themselves and to showing love and commitment and caring for the people with dementia and many other families is not only critical for the well-being of the people living with dementia, but also provide a great satisfaction for themselves. They feel they are capable of taking good care of people living with dementia and other family members who suffered from this process as well. We also found that care partners have great wisdom to respond to different problematic situations, which you might have heard from Loretta. Besides solving or avoiding the problems, care partners also find it was very important to be able to stop and watch, observe how the problematic situation evolve and change, and then make decisions. Sometimes it is important for them to be able to accept things that are out of control and move on to other things that they're able to improve. This non-judgmental awareness and acceptance of the present moment and experiences are showing to be critical for care partners to make the right decision for themselves and for the people they care for. In the end, we found that resilient care partners knows what they want and don't want. Help offered to them are not always helpful. Sometimes it can be disturbing, burdensome, and intrusive. Care partners have to be able to say no in those situations. These findings suggest that we should view care partners as competent and knowledgeable experts and recognize their right to choose or reject unwanted or intrusive help. It should be also viewed as an opportunity for other family and friends and care providers to reassess when and where and what support the care partners needs. I would like to share an example from an interview with you about a resilient care partner, what resilient care partner do during this challenging situation. And Jason is a 20-year-old Black man who has been caring for his father for 4 years. Chris has vascular dementia, although he was not diagnosed, or the diagnosis was not shared with Jason until the health crisis. Chris recently experiences a health crisis, resulting in EI visits due to urinary tract infections and behavior disturbances. The main challenges Jason experiences is first, navigating the healthcare system. They have to access services from a long distance, and he struggled to think about how he can communicate with healthcare providers about how to care for his dad. He also faced the challenges of managing his own sadness and fear due to Chris's sudden and continuing deterioration. Let's see what Jason has done. So first, he emphasized that during this time, he decided to put his dad's care over everything else. He tried to be strong, not only for himself and his dad, but also for the rest of the family, who are also very sad and worried during that time. He tried to solve the problem by looking for a closer services providers. He asked for help from service providers and trying to learn how to care for his father. He also received help offered by other family members when they're showing up and being there with him. When he felt really overwhelmed, he decided to went out for a walk, and he prayed and talked to God about his fear. Through talking with service providers, he learned how to monitor and prevent UTI for now and in the future. He also reflected on how his dad told him about uncertainty of life and death and find peace and embrace the uncertain future with his dad. Jason shared how these behaviors really made him feel recovered and grown up from this process. He felt he was able to take care of his family, and he felt he became a less selfish person after all experience all this. In our interview, not everyone was like Jason, who adopted most of the resilience behaviors. We did find care partner only adopted some of the behavior, but not others, which impacted their capacity to overcome the challenging situation. Therefore, different care partners might require different resilience-enhancing interventions. Also demonstrate the value of this framework for future research. Overall, our findings really provide a comprehensive model for developing and evaluating behavior-based measure to capture dementia care partner resilience, which is also our immediate step. And the measure can guide future research to explore factors shaping care partners' resilience behaviors. We want to understand who is resilient and why, and the people from different cultural backgrounds with different socioeconomic status might have adopting different type of behaviors. Those knowledges inform future interventions that aim to enhancing care partners' resilience. Lastly, our finding really suggests the need to develop innovative resilience-enhancing interventions such as mindfulness and compassion-related interventions. It's also highlighted the importance to collaborating with a care partner to co-design support program. Care partners' insights and lived experiences are so valuable to develop a feasible, accessible, and useful service program. And this is the references for my presentations, and thank you very much. And please reach out to me if you have any questions or feedback and suggestions about our work on care partner resilience. Thank you very much.
Thank you very much, Wanjin. Next, we'll hear from Dr. Cothran.
Thank you. Thank you to the organizers for such an important topic and for the invitation to join today's amazing panel of speakers. I'm delighted to speak to you today about resilience in dementia caregiving, a research perspective. Although we are in a virtual format, I do want to acknowledge that the National Alliance for Caregiving is physically housed on the traditional lands of the Anacostan and Piscataway people. Next slide, please. Actually, you can just stay where you are. For those who may not be familiar with us, we are a membership-based organization established in 1996, focusing on building health, wealth, and equity for America's 53 million family caregivers across lifespan and condition. We are comprised of more than 60 organizations and a network of more than 80 state and local caregiving coalitions and caregiving advocates. We have 4 core strategies surrounding research, innovation, thought leadership, and advocacy. Next slide, please. In relation to our core strategies, I'll draw your attention to our research strategy, which is to elevate family caregiving work through credible, transformative, original research, providing data to researchers, and leading a national network of caregiving experts. Next slide, please. Resilience today, that we'll be using a definition to guide us, is a capacity to adapt and persevere in the face of stress. And with this guiding definition, I want to highlight 6 attributes of caregiver resilience I see. Next slide, please. For the first attribute, reframing. Despite many challenges, dementia caregivers report a sense of purpose, satisfaction, an opportunity to resolve conflict and strengthen relationships. They also see caregiving as a way of giving back and often acknowledge special moments of breakthrough recognition or laughter. Next slide, please. Drawing from our 2017 report, Dementia Caregiving in the U.S., the next attribute is asking for and accepting help. When we compare, 62% of dementia caregivers share caregiving. That is, they are not the sole caregiver. Next slide, please. 45% of dementia caregivers receive help from aides, housekeepers, or others, and they are twice as likely to use respite. Next slide, please. Additionally, 37% of dementia caregivers are requesting financial help. Next slide, please. The third attribute, using resources, 45% of dementia caregivers are modifying their homes. Next slide, please. And 32% are using transportation services for their care recipient. Next slide, please. For the fourth attribute, working. Although individual reasons will vary, 6 in 10 caregivers are employed and 57% are full-time. Next slide, please. Along the lines of working but representing the fifth attribute, dementia caregivers are speaking up, where 70% are making their supervisors aware of their caregiving role. Next slide, please. 44% of dementia caregivers are also speaking up when being asked about what they need to provide care for their care recipient. Next slide, please. The final attribute of caregiver resilience that I see is planning for the future, with 56% of dementia caregivers having finances, healthcare decisions, and living arrangements in place. Next slide, please. Now, while I've highlighted 6 general attributes of caregiver resilience using some of our data to provide context, there are 2 important research challenges to highlight. One is that there is limited objective data on caregiver resilience. And the second is that proxy measures, including what I've just presented today, are the closest alternative. Next slide, please. From a research perspective, without resilience measures or data to supplement the lived experience, we don't have an accurate picture of caregiver resilience. Essentially, we don't know what we don't know, and further research is needed. And this is where the work of Dr. Shao and her team are helping to fill this gap. Next slide, please. Before I conclude my comments today, I do have a few words of caution. First, while stress is a normal function of life, we must be careful not to overlook the long-term nature of dementia caregiving and the physical and mental health consequences associated with chronic stress. Second, Given the disparate impact of Alzheimer's disease, plus the limited geographic accessibility of Alzheimer's disease research centers, dementia caregiving does not affect everyone equally. For example, almost 1/3, I'll let you know, thank you. For example, almost 1/3 of caregivers in our report say it is difficult to find affordable services where social determinants of health are one aspect that play a critical role in the caregiving context. Further, caregivers who are women, LGBTQ+ caregivers, Black, Indigenous, or people of color, plus the wider diversity within all of these communities, as well as the multiple intersecting identities, extends the nuance, complexity, and inequality. Finally, the framing of resilience, especially in the context of caregiving, contributes to the invisible, undervalued, and unsupported labor of caregivers in our society. Even while celebrating caregivers due to their adaptability and persistence, we cannot normalize the work caregivers uphold in our society and ignore the necessity of adequate support. Dementia caregivers are making a way in stressful and challenging circumstances that evolve over time, and enhanced infrastructural supports are critical. Caregivers need paid family medical leave, up to 12 weeks of partial income when they take time off to be a caregiver. They need refundable tax credits to help defray the costs of caregiving, and Social Security credits added to a person's career earnings when they have taken time to be a caregiver. In addition, equitable employment policies and protections are needed that given that our data highlights dementia caregivers have slightly less workplace benefits than non-dementia caregivers in terms of paid leave, employee assistance programs, telecommuting options, information, referral, or counseling. Caregivers often rely on the direct care workforce, and a strengthened direct care workforce, including retention and training, is absolutely critical. Lastly, we must recognize and include caregivers as the integral members of the healthcare team that they are. Again, using our data as an illustration, when 56% of dementia caregivers are not being asked what they need to provide care for their care recipient, this is a missed opportunity to ensure continuity of care and the positive health outcomes that are desired. Next slide, please. So as I wrap up, this is our report that I used to guide my data that I presented and shared with you today, which was done in partnership with the Alzheimer's Association. It can be found on our website, www.caregiving.org, if you are interested in reading further. Next slide, please. Thank you. And here's my contact information and our website again.
Thank you very much, Fawn. And next, we're going to hear from Diana Shulikos.
Yep, thank you, Erin, Elizabeth, and Team ACL for inviting me to share pieces of my own personal story and also to shine light on Lorenzo's house. And also honored to be on a panel with Dr. Sho and Loretta and Dr. Catherine. The sort of theme or philosophy or practice that I will be shining light on is this idea of shifting our mindset as a care partner. And the idea of shifting our mindset can shift our own narrative of how we live, how we walk as a family with younger onset dementia. Next. So I got really lucky with love. I fell madly in love with Lorenzo, who is here with our two sons, Justin and Lucas. This was a couple years before what I call our family diagnosis. When Lorenzo was diagnosed, we sort of wore this new identity now as a younger family walking with dementia. And we learned very, very quickly that there are really so few places for us to land and feel community. So my response to this was that maybe I need to first figure out how I'm going to respond in our home as a mom, as a wife, and also as a woman who was a full-time career person and breadwinner. And then I also thought to myself, well, maybe since there is so little in this space, maybe we could build something, a place where families like mine who were younger walking with dementia could go. So the idea is that our response that I'm going to share today is kind of twofold. One, how we walked in our home, and then two, just the love that lit Lorenzo's house. I will open by saying, and next slide, please. I will open by saying that, this is Lorenzo and Diana's personal journey. And we know that this experience brings so much suffering and devastation and exhaustion and darkness. We know this. And I'm grateful for the opportunity when Erin says, let's shine light on what we can do, the good that we can bring to how this diagnosis impacts our family. And when I thought about our top 5, gratitude is self-care. I think as a care partner waking up every day, I was always looking for bits of light. I was very conscious and intentional about how I sip my cup of coffee in the morning, how I would sit maybe on our little terrace when the sun came out for 2 minutes. And that was my moment of respite. And yes, we often talk about a weekend away or a massage. Those weren't really the things I was looking for. It was more the sweet text that came from a friend and those moments of being grateful for anything and everything. And those pieces really, I think, help sustain me personally. So gratitude is self-care. The next is that music changes everything. For Lorenzo and for Justin and Lucas and, our sons were 11 and 13 upon diagnosis. Music changes everything. When my husband was not experiencing joy, turning on everyone from Stevie Wonder to Elton John to Miles Davis to Jay-Z, they were all care partners with me in our experience. So music is king really in our family. Cannot underestimate how important investing in Alexa was for our family. The next piece is really about methods of love. We fall in love with a person, and then this brain condition and this brain change changes him. The ideas of how that love looks changes. And something Loretta said is exactly what I think this new methods of love is about, which is we can show our love through learning everything about this condition. We can show our love by seeing behaviors and experiencing behaviors and seeking out the resources to respond to these behaviors with as much patience and love and information as possible. So when we think about rethinking how love looks, because it does look different, it's not gone, it's just shifted. And I think, again, that whole concept of shift the narrative plays into the way we look at in my case, my spouse, is how can I find love today? How are we going to uncover love today? And it has to be in shifting how we look at love. It's still there. It's alive if we are able to find the gratitude, pull back the shades, see the bits of light. And the one key driving piece is really understanding as much as we can what our loved one is experiencing and how to respond to it with love. Another big piece was rethinking our home design. This was, I really often would say that our home turned into a museum. I got a bistro on the table, so we never did make it to Paris together, but we went every morning for breakfast. The TV would be on during the day because my husband loved to be interviewed, and he was interviewing with the news, and it became an important part of his experience that he was engaging with some kind of a news report that was on the TV. We swapped out our dining room table and put a pool table in our home. We really tried to recreate and rethink how the structure, how the design of our home looked. So this was a place that met Lorenzo's needs and also was a place that the family could also have a sense of ownership in as well. So bringing my sons into that experience of, guys, this is now a new part of our identity. How do we shift our home, and getting the family to be a part of that? I will always say, and I consistently say, that this is a diagnosis of the family, right? And everyone involved in that, and always at different degrees, because we wear this experience differently, we absorb it differently, but everything together. And the last one was really the power of connection, and this idea of connecting with good friends, beautiful family who understand, beautiful, but really with someone ideally who is able to understand your journey. And that is the perfect segue to Lorenzo's house, which is and we can shift to the next one. Thank you. Why Lorenzo's house? This shift from 2.5 years ago, I founded Lorenzo's house in this bedroom, which is my son's. It was his bedroom, and I turned it into our home office. And there was a reason why, right? The reason why is that younger families living with dementia, younger families are unseen and misunderstood and under-resourced. The stigma is that it is a older person's diagnosis and disease, and it is not. There's a 200% increase in individuals aged 30 to 64 with younger onset. And that was a study, a Blue Cross Blue Shield study in 2013. And when someone is diagnosed with younger onset, and don't have that be confused with early onset, because early onset could insinuate early in the diagnosis, versus younger, meaning before the age of 65. There are a unique set of family experiences and challenges that often younger people go undiagnosed or misdiagnosed, forced to leave careers early, income loss, raising younger children, as is now very quickly becomes a single parent. And there I won't read those, but there are unique challenges to the profile of a younger family. Next. Our model at Lorenzo's house, we are founded in Chicago, but we are an international organization. In just 2.5 years. We are exclusively and sort of unapologetically focused on just younger families living with any form of dementia. Our tagline is "We bring light." Our mission is "We empower families living with younger onset." And really, it is a labor of love. Over 400 families are now receiving our services. There are 3 components: our care partner spaces, that is for the primary care partner, our youth initiatives, and our memory academy. Our memory academy is for those who are living with the diagnosis, our loved one. I'm going to shine light on our youth initiatives, because this is really the way that we've been starting to build out our organization is really through the lens of our youth. Next, this is going to be a video clip from Lucas. At Lorenzo's house, we provide safe, brave spaces for our youth to connect with other youth who are walking this similar journey. We just had our family night in Chicago. We had over 100 youth at our family, young people and their parents at our family night on Friday night. And there was so much love in this room. It was an electrifying experience, because we don't get to see each other who are experiencing this journey. We're a niche group, a sizable niche group. And when you could see young people sitting at a table and having this brotherhood and sisterhood because they have found someone who gets them, it is the most provocative, empowering thing you've ever seen, and it is so needed. So Lucas is one of our youth, and I'd love to, we are sharing this with you, and he's one voice of many who've shared pieces of our story, who feel safe enough to share pieces of our story. I've often said that I think our youth have it the hardest, and yet their voice is the softest. And keep in mind that every youth who we are working with at Lorenzo's house is a youth who is walking with a parent diagnosed, a mom or a dad or the guardian who has raised them diagnosed, not an uncle or an aunt or a grandma or a grandpa. So this is Lucas, and thank you for listening.
When my dad was diagnosed with younger onset Alzheimer's, I was 11. My parents got the family together and explained it to us. I didn't really understand, and so I took time for granted. I had no idea of the damage it was going to cause all of us. My mom kept us strong, but on the inside was sad. And me and my brother did not want to talk about it. I remember my dad. He became quiet and low-spirited when he was usually playful and positive. At first, it seemed like things stayed the same. My dad would still drive me to practice, walk me to school, and ask me a bunch of questions. But then going into my 7th grade year, I saw a big difference. That fall, he picked me up from a friend's house and drove me home. Only, he took me to his childhood home on the south side of Chicago. We would play board games as a family, and he would get confused. We don't play anymore. Life loss is fun. He would target my big brother. He would go into his room at night and accuse him of taking his clients. He would ask awkward questions at the wrong time. We started to stay home, stopped having people over, and didn't take family trips anymore. Life became boring. At times, I feel annoyed and embarrassed with my dad. I know this is unfair because my dad is sick and can't help it. One of the things I suffer with is that I think I'll remember him as someone I didn't really know, someone I took care of. I'll never have the chance to have deep and meaningful conversations with him. I think about how he could have impacted me and made me a better person. I know if I keep on thinking about it, it'll bring me more pain, so I try not to. Other young people have a similar story, and knowing that I am not alone gives me hope. This is why Lorenzo's camp is going to be a good thing. We can empathize with each other, build relationships with people who understand, and support each other along the way. Today, things are better in many ways because we are stronger as a family. We understand how to manage things and have some fun again. It's not normal, but it's better. I'll take care of my family, try to be as normal as a teenager as I can, and just and deal with the deck I've been dealt. I'm learning to accept things. I know that I'll come out of this stronger, and most days I think my dad would be proud of me.
Next slide, please. So just to reflect on Lucas, and I really don't know what words we can share after hearing this piece. There are dozens of kids who are walking this journey with their parents who do not have the words to describe the complexities of this disease, the layers of confusion it can bring, and the isolation that they experience. But when our kids find each other at the Light Club, which is it's like a support group, they don't want to call it a support group. It's a virtual hangout on Wednesday nights. When our youth are able to come together, a youth summit, and at our Be the Spark, they find community. They're building an alliance where there once was none, and it is incredibly powerful. And it's a healing place for our kids, and it is so critically needed. Our youth summit is coming up. It will be our 3rd annual youth summit in just 2.5 years. Our first year, we had just about 20 youth. Last year, we had in 2022 about 43 youth. And this year, we have over 80 and counting. And it is on June 17th, and it is a day where we bring partners in. Our youth really lead these sessions. They decide what the session topics are, and they lead them with a professional in the space. But really, they are the ones who are guiding, and we are constantly using our youth as a compass, and really our families, their voices are driving and building Lorenzo's house. Our Be the Spark campaign came about because we've got younger professionals who want to be a part of a community, who are advocates. So incredibly powerful. Sometimes we think, oh gosh, the stigma around not being able to talk. We can talk about cancer. Why can't we talk about dementia? And you got young people who are so inspired and who are now building. There's an international board at Lorenzo's house, and then now there's this Be the Spark campaign to start a chapter in your own town. And coming soon, our kids again came up with this idea of how do we shift the narrative and shine light on stigma, because there's this sense of I want to do something in my home and I want to be an informed daughter or son, but I also want to be someone who is actively dismantling the stigmas that surround my family, my dad or my mom, and even myself. So these are just a few of the early shots of light that our kids are building as a way to both sustain themselves and build a community where they can find direction and support, and to build this path for those who come behind them until a cure is found. Next slide. And then these are our values, and Lorenzo's house is a beautiful place. It's healing me. I'm so grateful. Thank you, Erin, for allowing us to shine light on it. And follow us on socials. There was a glitch here that should, and the one where I think it should say info@lorenzoshouse.com, not just Lorenzo, or it should be info@lorenzoshouse.org, not just lorenzoshouse.org if you would like to reach out. So it should be info@. Thank you, everyone, for the opportunity.
Thanks to each of you for the amazing presentations that you brought. We've really been able to discuss resilience in caregiving from such a broad spectrum, talking from the perspective of caregivers, the issue overall, as well as the the potential for advances in research. We have some questions that we have received from the attendees, and I'm just gonna throw them out there. If I know who it is that it's might be logical to start with, I'll say it. If not, I'll just let you all sort of go it'll go organically through you all, because you're the experts, certainly not me. The first question is how do you find resilience and resources for late stage Alzheimer's when my spouse is not communicating or responding, just staring straight ahead and not wanting to be touched? I think, Loretta, this might be a good one for you to jump in, and then we can move from there.
Yeah, thanks so much. I was really lucky in one sense in that I mentioned the Lego bricks. We had been doing that my whole life. And so we just kept that going. And even on the day that she died, she had Lego bricks in her hands. That's so unusual at late stage. So one of the things I would do is see if you could get a response from him in something that you all used to do all the time. It was stunning that after my mom, Lego did help her find a lot of her words, and it kept her frustration down when they couldn't find words. But even at the end, when she could only say one or two words and did the kind of stay, the Legos always brought her back. So I would start with that, and we could certainly talk offline about some activities. I've been to people's house with many activities to try to do things. That brings there, I agree with you. It is the hardest thing, but I think, kind of like Diana was saying too, music was also wonderful for us. I agree with her. Thank you, Alexa, because we played everything in the car. Her favorite station was Frank Sinatra, and you would see her head, doing this, so you knew they're in there. And I think one of the hardest things for us when it gets to that very, very last piece is to bring them out. And I think Robin Roberts kind of said it best. She selected us one of her Thriver Thursdays, and she said, you spent so much time trying to bring your mother out. I really did. I think that was my thing, to go. She was still in there, and I was trying to get her out, bring her out, even on that last day. And, I've told many people, I showed the last picture I took of her with the Lego bricks on the day she died. And I said, I promised her that we would do, I didn't know it'd be 16 years, but I promised her we'd have joy every day. And no, we know it, the whole day's not joy, but kind of like Dynasty, you find one moment, oh, yay, that was his favorite song or whatever it was. And so I stuck with that. And so my only regret is that she's not here. But I, as the kids say on TikTok, I understood the assignment. I gave her joy every day. And if I die with Lego bricks in my hand, I'm gonna be really happy too. But I think the hardest part is, just trying to erase the stare. But see if you could try some different things. Start with the music and see if he comes around, even a little. If you get like a little glimpse of a smile that will make you remember, times I used to share. That's a whole lot better than nothing.
Does anybody else have anything that they'd like to follow on with Loretta's answer?
And I just want to add one point that I heard stories from care partners when things are really challenging, what is the importance is how to accept the situation and try and find a meaning from that process. Maybe if there's other families or friends, that is important for your loved ones. You can invite them and connecting with them and share your memories and sorrow and joy with them. And that process itself will also bring meaning to the process. Mm-hmm. Thank you.
No, here I was on mute. Sorry about that. Anybody else? Okay. It's clear that there's a need for much more research on resilience in caregiving. Do you have any suggestions on ways to advance the research on resilience in caregiving? I know Dr. Shou gave us some thoughts on it, but I thought others might, Dr. Shou, you might have something to add, and everybody else might have some thoughts on it as well.
Yeah, I'm happy to get us started. One thing, as I mentioned, and it's for developing the measure. If we do not have a good measure to really capture their experiences, I know there are resilience measures that can be used, but can use it, but acknowledge the limitations of that we might miss the point of care partners. Have to start with somewhere. And I also think it's important to do qualitative research to continue asking care partners from very different background experiences, ask about what the resilience means to them, because it can vary different in very different contexts. And I think there are so many innovations going on, as we have learned today. There's so much innovative programs and services developed by practitioners who are on the front line. I think researchers shouldn't think of you just to go guide them, but to collaborate with them, learn from their wisdom, and maybe evaluate the programs and develop a program with the practitioners and care partners, and to continue developing the research on resilience in caregiving.
I'll just say I don't have anything further to add, but thank you for highlighting the importance of that qualitative aspect, really correlating with the caregiver, the lived caregiver experience. Once we have that perspective in combination with the development of measures and the continued use of measures, that we can certainly move forward. Please jump in, Ms. Loretta. I look forward to hearing your comments.
Yeah, so that's such an important question. If I could change one thing, I might change one thing. So I mentioned briefly the facilitator thing that I use, Lego Serious Play. It is a thing, and I'm a trained facilitator in that methodology. And what the premise of it is fairly simple. It does just what we just heard. It helps people build memories. Okay, and so what I try to do, I started, my focus was just a selfish thing, because it worked very well with my mother. I started doing it at adult days. Programs, memory care facilities where I'm a national speaker. And then during COVID, Johns Hopkins, who was my largest partner, they like, can you do something with caregivers? They're home all day now with mom and dad, and whose adult day is closed. What in the world can we do? And so I started building with the caregivers online, hope and joy and resilience. And I just did a whole thing all day last Wednesday with the staff of Keswick in Baltimore, which is a multi-care facility. And it's stunning what I had them build, a bridge to resilience when you're feeling down. And then the whole premise of Lego Serious Play is everybody agrees to build, everybody agrees to share what they built, and kind of go around the circle. Lego created it as a way to get their own business to, the team members to communicate more effectively and to listen, and that all voices are heard. And that was perfect for dementia for me, because it doesn't say all voices are heard except for people with dementia. It did not say that. So that was like a winner for me. So I started with them, and I wasn't overlooking the caregivers intentionally, but what people have asked me, have I ever tracked with the people with dementia before? At Sunrise Senior Living in Silver Spring, Maryland, a woman who hadn't talked in years talked after I had them build their favorite vacation with their family members. And they had gone on a cruise 15 years ago, and all of a sudden the woman started talking again, and people just went berserk. And for the caregivers, it's so emotional. They talk about being in a box. They'll build this Lego box with them in it that they feel like they can't escape. And nobody's going to judge you if you say that, because they felt like they were in the box too. And so everybody shares, and you feel so safe. I think Diana did such a great job of talking about Lorenzo's house and how it's that space. And so, everybody's just building this thing. And I think the emotion of it is when they point to the different pieces. Like when I asked my mother to build how she felt about her dementia diagnosis, she took the little Lego person and she, popped the head off of it and just held it up and said, I feel like in a few years I'm going to lose my head. I put that on LinkedIn and people went crazy. What an amazing way for her to kind of do that. But I think what we have to remember is, they're still in there. But when I say I wish I could do one thing differently, it would have been to not only track how my mother, seemed to process the memories and what she built. She was always building that house that, she grew up in 1929. I'm talking about the house that I grew up in 1959. And so that they go way back and they can build these amazing things based on their knowledge. So I, when the New York Times came, I thought, well, how can she do that? Because she had the blank stare the whole time he was there. And then at the end, he says, let me see the Lego bricks, because she had just stared there the whole time. And so when I popped the top off the Lego bricks and threw it on the table, she came right back to life, just like I said. She said, oh, hello, like he had just walked in and he had been there an hour. He's like, oh, why can she do that? I don't have any idea. And at the time I didn't care. And I know I probably should have cared to track it or whatever, but I didn't have a research partner. I didn't know how to get one. I was too busy trying to bring the joy rather than worry about that. So if I could do one thing differently, I would look at how it works or how it kind of got, brings out those kinds of memories that we could track. So now when I go and I'm working with people with dementia, especially if they talk again, I'm trying to track what we were doing at the time and that kind of stuff. But I'm not a researcher, but that's kind of the best I could do. Thanks, Anna.
And can I add something that's different than Loretta? I love your energy. Let's have lunch, even though
Yeah.
seriously, and everybody here, just very quickly, a plug for young people who are walking with their parents. So many of them don't want to be seen as caregivers. They don't know what language is, right? But so I say that with love, that we need researchers who are looking specifically at our young people who have a parent, because they are going to know this diagnosis. They're going to understand this better than any of us.
Mm-hmm.
As an 11-year-old, we're 4-year-olds, 9-year-olds, 13-year-olds. So I would say I've only been introduced to 2 in the UK and 1 here, who are looking at younger children and that kind of research. So if you're interested in that.
Absolutely amazing. It's so good to be here in your energy. I'm getting goosebumpy over here. So the next question we have is, what practical suggestions do you have for healthcare staff, docs, nurses, community health workers, to support and enhance resilience in their patients, or the people that they work with, not necessarily patients?
Mm.
Who wants to start with that one?
Well, I'll just say what happened on Wednesday when I went. Lego Serious Play usually takes between 90 minutes and 2 hours. And so they call and they say, I only have 30 minutes to give you for each group I need you to work with. We went to every floor, and whoever was available on that floor, the chef, the physical therapist, the housekeeper. I mean, we just threw them at tables and they built all this stuff, and they were building, team resilience. One of the reasons they wanted to do it was they didn't feel that some of the people bounced back after COVID. And so they wanted to look at how that felt. Some of what they shared was stunning. I had to just come home and decompress. It was absolutely amazing. So they were encouraging, they cheered for each other. And then 2 days later, I got a note from the CEO that said they are still sitting at their desk building. Like you said, I suggested they keep that as stress reducer kind of things. But he said, I thought it would be good. He said, the results just, I don't know whenever it'll wear off, but he said, it's just been stunning. The whole building was buzzing. I'd never done anything that fast. And then I called it Speed Lego, and we did it 9 sessions with 92 people. And it was one of the most unbelievable. I never moved that fast, I don't think, ever in my life, but it was worth every single second to see them cheering for each other. And even some of them had been there 10 or 12 years working together. They learned stuff from that Lego build that they would never share in a regular conversation, because it's not a regular conversation. It's not something you're going to talk about around the coffee machine. It's, I'm having them build something and now is really your point about, what is their definition of resilience? We started with that. People were like, oh. And so one person, had a thing, to keep them from jumping off this little Brit. I mean, it was out there. So that's how I use it.
Thank you. Anybody else have thoughts about practitioners? And
I have a thought that I'd like to share. Actually, I have two, and I really would love to encourage Diana and Loretta to please let me know if you agree, because I look to you both as the experts in walking this walk. But one is ask caregivers, like just really acknowledging them. And I hear you, Diana, about the young caregivers or those who don't even identify themselves as caregivers, one, because of their age, and just in general, this is still a challenge that we're dealing with in terms of the nomenclature. But even asking caregivers how they are, acknowledging them, there is still a lack of acknowledgement from caregivers, unfortunately, from our healthcare system. So that's the first thing. And the second thing is, I would actually even encourage the normalization of caregivers, and excuse me, I'm just using that term for now, but encourage the normalization of caregivers to care for themselves. And I know that that's no simple thing, but if you hear it from your provider who is like, when was the last time that you had a doctor's appointment, or when did you go get your teeth checked out? And saying, it's okay to take some time for yourself because you can't pour from an empty cup. I think normalizing those pieces, just starting with asking and normalizing how important it is for the caregivers to find ways to care for themselves and whatever that looks like. And again, those are my thoughts. But again, I look to you, Loretta and Diana, for your just experiential wisdom.
you're on mute, Diana.
Sorry about that. Yeah, I think you have crushed it by just being able to ask, to state it, to ask the question. And even, I'll always use that language of, and I don't know if this is the right language, but like it is a diagnosis of the family. Usually you use the word condition, but it's our condition. We are all a part of this. And I think we have no idea this new space we're entering into. We don't have a clue. We're in shock when the diagnosis comes, but there's a sense of relief sometimes, like, oh gosh, there's an answer. But then the next step, if someone told me that the next step is not just about Lorenzo, that would save me some time. I even had my mom, and I'm still, then you become kind of this mediocre everything, at least my mindset was, God, I'm not the mom, I'm not this, I'm not, but I needed my own mother to say, Diana, keep an eye on Justin, because you're so focused on your husband right now that I wasn't, and I thought I was still given the love, but I guess if we can come up with some model, some universal way of being able to say with dementia, and I can only speak for the disease of Alzheimer's, but that this is the family walks this. This is a diagnosis of the family. And yes, Lorenzo will take this path, but your sons and you have other care paths, and we don't, and recognize that. I think that's huge. And then the model of care teams is brilliant. After I'm like you, Loretta, and your heartfelt, excruciating story you shared about a neurologist who came in. A, I'm so sorry. And then B, it's like, how many neurologists did we say, you are not my neurologist? I have to follow you, right? But then I got so fortunate at U Chicago Medicine in the south side of Chicago. I mean, who gets that kind of care? Yeah. We're doctor deserts, neurologist deserts. We've got so many of our families coming from rural Kentucky and Oklahoma and Utah but that idea of that care team, so like a Dr. Mastriani and a Tessa and a Kristen, this whole team was a unit that closed in on us. But I had to look for that, right? And then I happen to be in a city where I have those resources. Yeah. I'll stop. I could talk too much though. Yeah.
That's amazing.
There's no talking too much. I would just add to that, getting caregiving into curriculum of workforce and making sure that they speak that same language. I'm not the expert that you guys are, but I've lived this too, and not, my mother was older, but my grandmother had the early onset, so I get it. And having it in what we do at ACL, getting it into the workforce development and the workforce is super important.
Super important.
Mm-hmm.
Let's see. So do any of you have any thoughts on the impact of support groups on caregiver resilience over time? That was a question that came in from our watchers.
They feel camaraderie in the group. So I co-moderate a Facebook support group, Us Against Alzheimer's. And again, people know, and the AARP Family Caregiver Discussion Group too, that is a lively thing as well. And you see people putting their actual truth on there because again, they know, today was the worst day ever. And you can say that. People say, oh, I can't believe you said that out loud. But you have to say that. That's better than keeping it. I hated doing COVID. And people say, how you doing? Oh, I'm fine. I was not fine. And I wasn't going to say I was. And so we just have to be honest about what it, and then people really respect that. Oh, Diana, thanks so much for sharing that. How you really feel. I feel like I can talk to you. I think they're very, not just helpful. I mean, they can be, life-saving in some cases. We've made some calls where we thought, I used to get up at 4 o'clock in the morning to go to work. I quit my job during COVID because so many caregivers were calling. But a woman in Canada who was in the support group wrote some things that definitely concerned us, and we got the Royal Canadian Mounted Police to ride by her house, and they talked to her and all that. And so we think they're so beneficial. And there are a couple of kids groups that get together as well. So I really appreciate that because, as you said, Diana, they have their own language. You don't want them sitting around with a bunch of 65-year-olds. When they have teenage things, they want dad to come see them play basketball like he used to, and we can talk about that. And so I think having the right people together, but they really can be life-saving. But I would get up in the morning and look online before I even got in the shower to make sure everybody looks good. Nobody looks like they're, about to go over the cliff or something. Then I would go ahead with my day. But I thought that was my responsibility to see how people were.
At Lorenzo's house, what has happened organically, again, asking our community, what do we need? And again, now we have something called our Bright Brunch. So it's a Saturday brunch where women hang out, and it's not a clinical format. It's a format where kind of like there might be 50 of us and we break into groups of 10, and then carers guide that. We're trying to figure out different models. That has become a women's group. It wasn't originally, but it's become a women's group. This is where we are today. Then there were a couple guys in there and they said, can we create our own thing, Diana? I said, well, that's what we want. Is that what we want? Well, now there's a light lounge for men. Started with 2 men, a guy from California, buttoned up executive from California, and this awesome guy from Michigan, Don and Dan. We can say their names. They're okay with that. They created the light lounge. There are now over 40 men at the light lounge.
Wow.
And what they say is, this is the best 90 minutes of my month.
That is so cool.
And they're all there talking about, I guess, in their, their it's a male care group. I don't know how you, how you measure all that and what that does, but it's there. I mean, these kinds of groups, and especially what I'm finding is that when you're really getting people who are narrowing down into your profile, like younger kids who have a parent, it's different, and somebody who's younger with kids. So I can't say enough about, and I'm not a big joiner. I don't like to join groups. I'd rather do the one-on-one thing, but when you're walking this, you begin to join and you lean in and you become a part of a sisterhood. Like it's an immediate sisterhood, period. It is a brotherhood. It is family. There's such a visceral, deep, like I got you. Like it's, because the journey's so hard. There's so much going on that you're like, okay, I got you. And somehow it just kind of connects us, and it's going back to the power of connection. If you do nothing but that, we can breathe better as people walk in this.
I'm closer to some of those people in the online support groups that I have never met than I am to some people in my own family. That is absolutely a truth. I would drive for miles and miles to see some of these people in person, that, you are sisters, by then. So it's amazing.
Yeah. Talk about silver lining. There it is. Mm-hmm. You got a new family, right?
You do. You do.
Well, this has been great. Thank you so much for your time, for your honesty. It got a little raw for me, at least. I don't know if it got a little raw for you guys. We so appreciate you being willing to share your experiences and your wisdom with us. We do have this series just for this. The webinar it was recorded, so it will be posted on this last slide. It shows where it's posted. If you don't see the slide and you're looking for it, just hit Focus on Aging in your Google and it'll come right up, because NIA must do an amazing job of doing their setups for their awareness. I just want to thank each and every one of you for being with us and taking the time to share this with our group. I don't have anything else to say, but thank you. Hopefully we'll continue to learn. Maybe we sparked a little bit of research development and some ideas in some researchers' heads about who needs to be thinking about who and talking about who, and getting some answers for working with youth and getting that resilience front and center, so that everybody survives.
Yes. And thank you all so much for having me. I put my information in the chat box because I realized I forgot that in my slides, but it's there.
Thank you. And I hope you all have a great remainder of your day. If there's any questions for any of us on the Federal Partners team, please reach out to us. We will get back to you as soon as we can if you have any other questions. Thank you so much.
Thank you all.
Everyone have a great day.